What's up, guys? Welcome to our Speak Out Loud YouTube channel.
Today's topic is electrolyte. So, Carolyn, what is electrolyte? Is electrolyte layperson language?
Well, most people know what electrolytes are, but if you need to explain what they are to a patient, you would say that they're minerals in the blood in the body.
Yeah, that's what I say to my patients when I give electrolytes. But when I here today to talk about all the functions of each electrolyte, what I noticed in the nursing program was that the pronunciation in English is different from Korean. So would like to talk about the pronunciation of each electrolyte, and at the end of the video we're going to talk about the orders of some electrolytes. Let's get down to business. We are not tech savvy yet, so here today we have index cards.
Whoa!
So let's start with these three main electrolytes, Carolyn.
So I'm going to say the word first, and then I want you to say the word along with Nurse G. Potassium.
Potassium.
Sodium.
Sodium.
Magnesium.
Magnesium. And these two electrolytes, the pronunciation in Korean are very different from the ones in English. In Korea, we call this natrium. This is kalium. But in English, this is sodium, this is potassium. Let's continue.
Chloride.
Chloride.
Phosphate.
Phosphate.
Calcium.
Calcium.
Bicarbonate.
Bicarbonate.
Milliequivalent.
Milliequivalent. So at work, these two, bicarbonate, we also say bicarb. And this unit, milliequivalent, we can also say 10 MEQ or 40 MEQ when you don't want to say milliequivalent. It sounds fancy, milliequivalent, but sometimes we just abbreviate. Hey, Dr. Carolyn.
Hey, what's up, Nurse G?
Yeah, did you see the blood work results for Mr. Martinez?
Why? What's up with the results?
Yeah, his potassium is low, it's 3.5.
Okay, I'll order 4 runs of potassium IVs.
Alright, thank you, Doc. So 방금 마르티네즈라는 환자의 포타시움이 3.5라고 했고요. 그러면은 이제 닥터가 4 runs of potassium IV라고 방금 말했거든요. Can you help me with this? 저희가 IV 백이 없어서 이렇게 인덱스 카드를 사용했습니다. 4 runs of potassium이라는 게 4개의 이렇게 오더를 냈다는 거거든요. 그래서 2개를 오더했으면 2 runs of potassium IV, 2 runs of magnesium or magnesium sulfate 이런 식으로 얘기를 하고요. 만약에 환자가 센트럴 라인이 있거나 아니면 다이얼리시스 리널 페이션트라서 플루이드 오버로드가 걱정이 될 때는 이렇게 40 MEQ in 100 ml is also called concentrated version or concentrated order or concentrated dose. 포타시움 IV 아니면 포타시움 태블릿 오더도 많고요. 포타시움 리퀴드 폼도 있습니다. 또 포타시움 이외에도 매그니슘도 많이 환자들한테 주는 약 중에 하나인데 이렇게 마그네슘 2g or 1g 짧게 얘기해서 meg라고 해요. 그냥 patient is getting 2 grams of meg at the moment or patient is getting 2 grams of magnesium for magnesium level of 1.8 이런 식으로도 얘기하고요.
How long do you run potassium?
How long do you run potassium? 이거는 포타시움 IV를 얼마나 오랫동안 줄 거냐라고 물어보는데요. 그러니까 한번 이렇게 IV를 걸었을 때 몇 시간 동안 주냐, 얼마 동안 주냐 이렇게 물어보고요. 10 milliequivalent of potassium runs for an hour. This time, Carolyn is the next shift nurse. So, Mr. Martinez, he's receiving potassium. His potassium was low, 3.5. So I started the first one. So you need to give him 3 runs of potassium.
Okay.
아니면 이렇게 얘기할 수 있어요. 이미 3개가 끝났고 하나만 더 주면 된다고 이제 얘기를 할 때는 He got 3 runs of potassium. So you need to give him 1 more run of potassium.
Okay. We hope that this video helped you out today.
앞으로도 계속 좋은 영상 그리고 꼭 필요한 영상 만들도록 노력하겠습니다.
And as always, 간호사 화이팅!
감사합니다.
감사합니다.